WHO has really put a lot of energy and time into thinking about how to engage with non-state actors. And they define non-state actors as either corporate, commercial businesses or NGOs, non-governmental organizations. So in May of this year, Margaret Chan released some guiding principles for partnerships and how people should engage with WHO. Basically, these are good principles. It's about how to engage with an intergovernmental organization, demonstrate a clear benefit to public health. You need to respect the intergovernmental nature of WHO, and this extends to other UN organizations. Support, enhance the evidence base, be actively managed to reduce or mitigate any sort of conflicts of interest, and be conducted on the basis of those principles: transparency, openness, inclusiveness, and accountability. About a year and a half ago, I was contacted by some colleagues in Canada, and they were looking for someone to help them as a consultant to develop a tool for government agencies to engage with the food and beverage industry. So I took on this project. They wanted something that policy analysts in the Canadian government could use at the national level, at the territorial and the provincial level, so that when Coke and Pepsi and General Mills came knocking at their door, the government official could say, you know, should I take the $2 million or shouldn't I? What sort of criteria do we use? So we worked really hard, and I did a big scoping of what's out there in terms of principles for guiding partnerships. And I found actually the Canadian Institute for Health Research had one of the best set of 5 principles on what should really be an ideal partnership. And what they've come up with is that partnerships should provide maximum benefit to society. It should be in the public interest. There should be innovation. It should add to value to research and knowledge translation and direct service programs. There should be compatibility, accountability, and stewardship. So we actually built these principles, and we worked over a year on this. This is much more difficult than I ever thought. And we developed a toolkit that the Canadians are now vetting up at the very highest levels. And it's a 6-step partnership decision-making framework for food and beverage industry engagement, because those are the corporate sectors that tend to arouse much more controversy than, say, the physical activity industry, although we can talk in the discussion about how food, beverage, and restaurant companies actually support a lot of physical activity initiatives for a variety of reasons. So I'll just go quickly with the 6 steps. Clarify the public health promotion goal and objectives for the partnership, because oftentimes partnerships are such where you have an agency that says, oh, Coke wants to give me $2 million, ooh, or this cause marketing relationship looks so seductive and so good, I think we should just take the $2 million, we can use it however we want. But what the groups, the NGOs or the government agency needs to do is back up. What's the public health promotion goal and objectives? If they can't really clarify that, chances are it's probably not a good fit. Step 2, look at the potential partner for compatibilities, convergence of interests, benefits, as well as divergence of interests or risks. Step 3, you need a plan to manage tensions, because they're going to come up, as well as perceived or actual conflicts of interest if you are going to enter into a partnership. Step 4 is develop a formal agreement to clarify the terms of the engagement. Step 5, ensure the partnership is accountable. And I'll talk a little more about accountability, because what you want to be is accountable to achieve the public health promotion goal and objectives you've outlined in step 1. And step 6 is once you finish the partnership, you need to communicate it, what you've done and what your outcomes are to a variety of audiences. So this is a framework that I developed after looking at 12 different frameworks across 10 different disciplines. And basically, it comes down to take the account, share the account, hold to account, and respond to the account. Taking the account, we're very good at doing this. We're very good at measuring and doing the M&E and doing the baseline and what's really going on. And we need to really take resources from a lot of different places to assess what exactly is going on around food environments and population health. Sharing the account is where you share that with all the stakeholders to say, okay, what do we know? Where are there gaps? Where are there loopholes? And so what's the next step? Holding to account is the most difficult of all the 4 steps. And that's where you've got an empowered independent group that can apply a range of incentives and say, ooh, Coke, Pepsi, you did a great job through the Healthy Weight Commitment Foundation, but you're maybe not doing so well with this other issue. And so it's a way to really either incentivize or disincentivize progress toward healthy food and physical activity environments. And then responding to the account is really improving and strengthening steps 1, 2, and 3. So I'm going to get to some of the examples of taking the account. We've got Access to Nutrition Index. Some of you may be familiar with this. It was initiated a few years ago, supported by the Gates Foundation and the Global Alliance for Improved Nutrition. And it's a really nice index to look across 7 different things: governance, products, accessibility, marketing, lifestyle, labeling, and engagement. And it gives each company, the top 20 companies in the world, a score and a ranking, and how they address obesity as well as undernutrition. Now it's transitioned to an NGO that's based in the Netherlands, but this is a really good model for taking the account. Another example that was spearheaded by Boyd Swinburne at the University of Auckland is to work with colleagues about 9 institutions across 14 countries to really begin to benchmark food environments, which is really what Informis is about. Informis stands for the International Network for Obesity and Obesity and NCD Research, Monitoring, and Action Support. So, thank you. Took a while to get that. But really, it's interested in benchmarking food environments, what government's doing on the left, as well as what the private sector policies and actions are doing on the right. And I'm going to give just a few examples from these really important 7 areas about food composition, labeling, food promotion, and food provision, so that we can stay on track. Now, I looked really hard to find a wonderful infographic for the International Food and Beverage Alliance, which is like an 11-member company that's made these pledges at the global level, but I couldn't. So I'm going to use this beautiful infographic that has been put out by the Business Network of Scaling Up Nutrition. And what's beautiful about it is you've got, nicely laid out, you've got Scaling Up Nutrition, you've got a number of companies that joined, you've got a number of companies or business associations that have been involved in the national planning, and it goes on and on. But as beautiful as it is, it's still outputs. And if you remember on Mauricio's slides, he had outputs, he had outcomes, and he had impact. So this is beautiful, and I think these are meaningful metrics to companies, but public health folks think differently. They think in terms of outcomes, which are longer term. So we need to figure out and reconcile what's going to be meaningful metrics for these different groups to really work toward.